Hello, my name's Laura Johnson, and I'm with the National Social Anxiety Center of Silicon Valley. I'm also the founder and director of the Cognitive Behavior Therapy Center of Silicon Valley. I've been in the counseling field for 15 years. I'm a licensed marriage and family therapist and a licensed professional clinical counselor. I have a passion for cognitive behavioral therapy, and I introduced schema therapy into my repertoire about 5 years ago. I'm both a certified cognitive therapist and an advanced certified schema therapist. Today I'm going to talk to you about schema modes for avoidant personality. So there are 4 categories of modes. Our goal in schema therapy is to help people remain in the healthy adult mode. The healthy adult mode is the part of you that is able to problem solve, pursue activities, has friendships, enjoys sports, is a good parent, and really is able to live in a healthy, balanced way. When something is difficult, you are able to see it for what it is and handle your emotions and not have to use any of the negative coping modes to deal with your emotions. The next set of modes are called the innate child modes. In schema therapy, we believe that everyone has child modes, and they're the parts of you that you were born with. And as you grow older, some of the modes you might have never learned to deal with when you were a child. You've never learned to self-soothe and validate those parts of you. And there's many different modes, but with avoidant personality, we typically tend to see the lonely child mode. Because you're not connecting with other people, you often feel very lonely, sad, maybe you even have a significant depression due to not having intimate relationships with other people. And with the lonely child mode, it's really important to identify what are the needs that haven't been met and how can you get them met as an adult. The next mode that is very typical with avoidant personality might be the humiliated and inferior child mode. With this mode, you might have the belief that you're inferior to other people, and thus you want to avoid other people to not have negative emotions triggered when you feel these feelings. The next type of mode that might be triggered in you, and it's more rare with avoidant personality, but it could happen, it's the angry child mode. So some people, when they feel anxiety, instead of getting anxious and retreating, they might have anger outbursts. And anger is often just a way to hide other feelings, such as anxiety and fear. Okay, next I'm going to talk to you about the maladaptive coping modes. There's 3 types. There's the surrender mode, the avoidance mode, and the overcompensating mode. The surrender mode is called the compliant surrenderer. And this is the mode that when you feel intimidated by something, you'll tend to retreat and surrender to other people, or maybe even surrender to the schema itself. So in this case, you might have a passive style, and some people might even perform passive-aggressive behaviors. And you might act in a self-deprecating way toward others, and people might see you as being non-assertive or passive. The avoidance modes are the ones you see most commonly with avoidant personality disorder. There's the detached protector, and that's when you do not want to feel your feelings and you withdraw psychologically from the pain of the schema. You might shut off your emotions, disconnect from others, and reject their help, and you might function in an almost robotic manner. While you may remain quite functional, people may not even know you're in detached protector mode, because this might be your go-to mode at work and in personal relationships, but it makes it really hard for people to connect with you. And this mode might also cause people to distance from you, because when they can't see your emotions, they may not realize that you are a likable and lovable person, and it becomes a self-fulfilling prophecy that folks act like they don't like you, but it's because you're not showing them your true self. Next, we have the detached self-soother mode. And if you remember my buddy Charles, this is the mode he tends to go into when he feels lonely and sad. And this is the mode where you use substances or activities to black out from your emotions. You may use alcohol and drugs. You may use gambling. It might be food. You might overeat to numb out. You might engage in dangerous sports. Some people become sex addicts. Some of you might be a workaholic. And these are all ways that you might be detaching from your emotions and getting your needs fulfilled in an unhealthy way. The next mode is the avoidant protector mode. And this mode is the behavioral avoidance. And this happens when you don't go places, you don't do things, you don't connect with people, and you kind of retreat and isolate from other people and from activities. And then there's the angry protector. In this mode, you might actually use anger to distance from other people. So you might have angry outbursts and rage, and that pushes people away. And then it becomes, again, a self-fulfilling prophecy that people don't like you because they're only seeing your angry, frustrated side. The next set of modes is called the overcompensation modes. These are a little less common with avoidant personality disorder, but I want to make you aware of what they are because you might see them in other people, and it might be helpful for you to be able to identify them. So the first one is called the attention and approval seeker. So this is when you really want to get a lot of attention and approval from other people, but you really exaggerate. And this might be when you see flamboyant people who are exaggerating and trying to be the life of the party. They're living for attention and approval. And the approval seeker might be one that you might identify with avoidant personality disorder, because you might like a lot of attention in order to feel good, and that might be important to you. Next is the self-aggrandizer, and these are the people that often have narcissistic personality disorder. They exaggerate and want to feel better than other people. They might think they're superior. This one's very uncommon with avoidant personality disorder, since folks with avoidance generally feel inferior to others. The next is called the overcontroller modes. And the one that's most common with avoidant personality would be the perfectionist overcontroller. And that's when you focus on perfectionism, and you might ruminate and exercise extreme control. So when you see a perfectionist overcontroller, they might have a bit of OCD in their personality as well. The last set of modes are called the maladaptive parent modes. And there's two types. There's the punitive parent and there's the demanding parent. The punitive parent mode is the type of mode where you have a belief that others should be punished. And when this mode is triggered, you might go into scolding other people. You might be thinking that you need to get even with them because they deserve it. I think this one's a little less common with avoidant personality, but it could be there, so I want to make you aware of it. Okay, the final mode is called the demanding parent mode. And the demanding parent has very high standards. It puts a lot of pressure on you to perform, and it's a really stressful mode to get into. And when you hear the voice of the demanding parent, you might feel anxious, you might want to avoid, you might feel even depressed at times when the demanding parent is telling you you have to achieve a high standard or you're not good enough. So that's an overview of the types of modes that we see in schema therapy. If you'd like to work on your schemas and your modes, I'd recommend that you find a certified schema therapist. You can do that by going to schematherapysociety.org, and there's a Find a Therapist tab there. You need to find a therapist that's in your state and licensed in your state. And there are many wonderfully trained therapists on that website, including myself. So I'd like to thank you for spending your time today watching this video, and I hope it was useful to you in some way.